to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borrelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Hi to everyone, and thanks for joining us today for another great topic. I really like doing these Instagram lives because it gives us a really good opportunity to talk about different resources that can assist people with navigating their health and just really learning more about patient advocacy. So I really wanted to extend a very warm welcome to Michelle. Michelle and I share the same mission to help people navigate their healthcare challenges. And Michelle, at a young age of 32, was diagnosed with non-Hodgkin's lymphoma. And her journey to recovery, during that, Michelle faced a lot of irregularities in the healthcare system. And to help others, she founded Revival Health and Wellness. And we'll talk more about that during the next few moments. So Michelle, thanks for joining. How are you doing?
I'm doing great. How are you?
Good. So, Michelle, can you start by telling us a bit about yourself and your background as an integrative nutrition coach?
Sure, absolutely. So I am a 7-year cancer survivor now, and I founded Revival Health and Wellness about 3 years ago. I attended the Institute for Integrative Nutrition School, where I obtained my certification as an integrative nutrition health coach. So because of my own struggles in cancer recovery, I knew very early on in cancer survivorship that I wanted to help other survivors recover and really just change the way cancer recovery was ignored and dealt with in the healthcare system. So I focus on working with cancer survivors and rebuilding your body, immunity, and just overall health after cancer.
That's awesome. It's great to have this resource because a large percentage of my clients have cancers. Many of them have rare cancers, and I really help them through that process of navigating through it. But once they do get to that point of remission, which that's our goal, there's so much more that they still need, to kind of navigate through and stuff. And it's so nice to have the resource like yourself. I was so excited when I found out about you and your company because I didn't know it existed before. So it's a great, great resource. Can you share your experience a little bit to your comfort level about what happened during the time that you were diagnosed with non-Hodgkin's lymphoma?
Well, I was 32 years old. I was under so much incredible stress. My mom had just passed away from cancer herself. She had a horrible battle with cancer. And we were the primary caregivers. So I really saw the ugly side of cancer and what it can do. And it was incredibly stressful. So when I was diagnosed, which was about a year after she passed away, I was totally caught off guard, and it was a whirlwind and completely overwhelming. Not to mention I was newly married, I was traveling, I was working, I was 32. I didn't think that cancer would come knocking on my door. So when I got the diagnosis, it really threw me through a whirlwind.
I can only imagine. And it's so amazing how, I feel like when bad things happen, it kind of happens at the worst time. Not that there's ever a good time, but it's always so many, things at once. I know, me personally, my father and my brother both got diagnosed with 2 different stage 4 cancers, 2 months apart, and then my son all at once. And I hear these stories so often from our clients too, and it's just one issue is terrible enough, but when you have all these things happening, it's very, very emotionally overwhelming.
Really, it really is. And I'm so sorry about your family's diagnosis as well, but I feel like it always happens in threes. And at least for me, I have a benign pituitary tumor, and I had that removed 6 months before my cancer diagnosis, which was 6 months after my mom's passing. So it was 3 traumatic things that happened back to back. And I kind of knew that, I don't know, you sometimes have just a gut feeling when you're it's not over. Something else is going to happen. It's not over because, it's a buildup.
No, and I feel like your gut instinct is so important, and especially with, parents. I'm a mom, I know you're a mom, and I listen to moms so much more than I used to because that motherly instinct is so true. You don't always I don't know how to explain it. It's not scientifically explainable, but it's true. So I do feel
100% true. I couldn't agree with you more. And that's actually kind of how I found out about my cancer. It's like a sidestep, totally different story, but how I found out about my cancer and my biggest symptom came from like a dream that I had about my mom after she passed, which forced me to go to the doctor and get diagnosed. So it was just like crazy. So I completely agree with you. And I think that, your intuition is your inner compass. It's your guide. You should always follow it.
100%. I agree. No, we think a lot alike.
We do.
So looking back, how do you think your experience could have been different with a private patient advocate? And did you even know what one was at that time? Because a lot of people still are not as familiar with what it is.
No, I didn't know what it was at the time. And it makes me sad because most people probably don't know about this resource. And the reality is that it's existing to help people. And I feel like if I knew about it, I probably would have been exposed to so many more resources that would have just made my journey a little bit easier, my recovery so much easier, and helped in so many different ways. I know when I was diagnosed, gosh, it was like I was inundated with tests and, the diagnosis and medications and chemo, and you're kind of almost rushed through the process where you don't get a second to stop and think, is this for me? Do I feel good about this? Is this the right doctor? Like, are our goals aligned? There's really no breathing room. You're kind of like thrown into it, and you really just don't know who to trust in that process. So you're just kind of going with the flow and not really understanding what your options are, which is crazy. So I think that the service that you provide is so incredibly important because you're protecting the patient and you're speaking on behalf of the patient, not for the healthcare system or insurance or anybody else. You really have the patient's goals in the forefront of your mind.
Yeah, and that's my favorite part of my job is that it's so personalized, and it's very different. Two people could have the same problem, but the way we have to approach it is completely different. So the uniqueness is what I enjoy as well, and being able to come to a successful outcome for both clients as well. So what's your favorite aspect of your job?
Just helping people. I have always been a helper with people, but I really promised myself after cancer, as I was going into cancer survivorship, that I would do anything I could possible for other people not to feel the way I felt after cancer and go through the struggles. I had to struggle so much to find my health after cancer, and there was no resource. There was like no Instagram really. I mean, barely. There was no resources out there to really help me navigate, this tricky time. So I really made that promise to myself that whatever I do, I'm going to get educated and make sure that I can help other people out there. It really is like such a privilege and just so fulfilling.
That's so nice that you did that. I think there's so many emotions that come with going into remission and getting out of this difficult time. And that's great that you really did prioritize, wanting to help others and use what you went through to make a difference. So that's amazing.
And I think it's important too, because so many cancer survivors out there know this, right? And I didn't know this going through recovery, and you probably don't know this as you're going through recovery, but you think that everything is going to be okay once you ring the bell and once cancer's over, treatment's done. You're like, I made it through chemo, made it through radiation, I'm okay now. But there really is this entire different chapter of trauma and processing and rebuilding that can be a very important time for you, yourself, your mind, and your body to heal. But we are so left in the dirt with it that it really becomes just kind of a terrible time where you don't know what to do. You don't know where to start. All the emotions are going. You're finally quiet. There's no one to hold your hand through the process anymore. Mm-hmm. So it really is such a critical and important time for people to get the help and the resources they need, for sure.
Yeah, no, you are absolutely right. I know, even like when people complete chemotherapy, like you said, and ring that bell, then it's like, okay, you're done. We'll see you in 6 months or whatever it is. And then it's almost like, well, you had this, schedule of doing all these tests and therapies and treatments. And then it's like, okay, good luck, be happy. But like, it's like, well, how do you get back to your life? Well, how happy should you be? Like, are you, yeah, exactly.
Who am I for all of this, right? There's a huge
Yeah.
identity crisis that occurs, and it's kind of sad too, because I feel like it's not talked about a lot. And when you don't talk about it, you feel so alone and trapped in it. And the reality is these are all completely normal and okay feelings to have after cancer. And the more you can find the help and resources, the less alone you feel. And then nobody really has to struggle when you have that community, or at least some of the resources to help at that time.
No, that's a great point. Great point. So what type of clients do you generally work with? Do you accept insurance? Do you provide virtual or in-person visits? Like, tell us a little bit about that.
Sure. So I work primarily with cancer survivors, but I also work with people who are trying to prevent cancer or have some sort of genetic link or exposure to cancer, and they really just want to live like a healthier lifestyle. So my one-on-one coaching program, it's a 6-month coaching program, very much focuses on that special time of recovery. And I cover like 6 key pillars in that program to really help people recover fully and wholly. I will accept insurance soon. That is a work in progress as we speak, but I mainly do virtual visits, just really so it allows me to work with clients nationwide and extend that reach, which is great. I have clients all over, so it's wonderful. I'm always open to face-to-face. It just doesn't seem to be the reality of the world these days, but it really is mainly virtual, yeah.
That's awesome. And then how do you customize your approach to meet like everyone's unique needs for every client?
That's a really great question. So we are all bio-individual. We are all different people. We have different experiences. And how do you really apply that when you're going through my program, right? So I mentioned a little bit earlier that I have 6 pillars of recovery that I focus on. And my 6-month program is compiled of addressing all of these 6 pillars. However, I might have a client come to me and say, I have a debilitating fear of anxiety and a fear of reoccurrence. I can't get up out of bed every day. It's really just overwhelming. I really need help with that. I take that pillar, and that is the main focus for my program for that person. I still address those other 5 areas of cancer recovery, but I really hone in and focus in on the pillar that person is struggling with. Or if somebody comes to me and they're like, what do I do with nutrition? Where do I start after cancer? What should I be eating? What shouldn't I be eating? I then take that pillar and make that the focus of my program. Okay, we're really going to address nutrition. The other areas are still addressed, but I focus on what the biggest gap is for my client and make sure I'm giving them the resources and tools to close that gap, but also addressing the other 5 areas of cancer recovery to ensure that we're addressing the mind, the body, movement, stress, everything. So everyone is really recovering fully.
That's amazing. That's super amazing. That sounds just the right path to take. I mean, everybody wants treatment and resources that are tailored to them because nobody fits into a cookie cutter plan. And sadly enough, a lot of times in healthcare, to kind of simplify the process, the treatment options are given like algorithms that like everyone's just supposed to fit into. And if they don't, then it's like, well, we don't really know what to tell you because you don't fit in this kind of plan that we're supposed to follow. So yes, very good point.
Sure.
So is there anything else that you wanted to mention that I didn't ask?
I think that the only other thing that kind of comes to mind is that if you've just finished cancer treatments and you're struggling and you don't know what to do and you don't know where to go, don't sit on it. Don't struggle through and make the same mistakes that I had to make to figure out what health is and what to do first and how to get the ball rolling. There is support out there. There are resources out there, and you have been through so much, and there's so much trauma that's done. You deserve to have peace and you deserve to have healing. So don't feel like you have to wait or figure it out on your own. There is a method to the madness of recovery, although it might be different for everybody. There is a method to it, and I encourage you to reach out. You can read my bio. You can send me a DM on Instagram or click my link in my bio to find out more information about those services, to find out about my story as well. But just know that you're not alone and you don't have to struggle through recovery, because that is too much for anybody to go through.
Correct. No, that's awesome. And Michelle, can you just mention what your Instagram name handle is so everyone knows?
I'm at revival.health.wellness.
Okay.
My website is revivalhealthwellness.com. And all of my information's up there. My story's on there. My coaching program. I offer a 6-month one-on-one coaching program. I will say that, the interesting thing about Revival and kind of how I've built this company is that, there's a lot of different nutrition programs out there for cancer survivors, right? There's so many that are floating around, but my program is built to really address the mind, the body, and nutrition. So nutrition is a piece of the puzzle, but everyone knows out there, when you're coming out of cancer treatments, there's so much more than just nutrition that goes along with it. There's a lot of PTSD that occurs and can come up as you're healing. So I really, really think it's important from like an integrative standpoint to heal. We're all connected. Our mind is so connected to our body. So you can't do one without the other. You have to it's a full internal makeover.
Compartmentalize one thing. Yes, correct. It's all connected. And we actually had a question asking how important nutrition is in recovery. And my opinion is that it's super, super important. But Michelle, do you want to comment on that?
Yeah, of course. Nutrition is key. It's the first place and the easiest place that you can start to help with energy, with sleep, with fatigue, with chemo brain. But it's also one of the most powerful things we have at our fingertips. What we put at the end of the fork is life-changing. So nutrition is a huge, huge piece of recovery. And again, it just helps with rebuilding the body after all the treatments and all the trauma that's happened.
I love what the comment you just made. What you put at the end of the fork is life-changing. That's so true. That's such a great point. Well, thank you so much, everyone, for joining us. And thank you so much, Michelle, for joining me today. If you have any further questions for either one of us, you know where to reach us, and we'd be happy to talk to you guys more.
Thank you so much for having me. This was so fun.
If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.